ನನ್ನ ಹೆಸರು ಸರೋಜಾ. 4 ವರ್ಷದಿಂದಲೂ ಭಾರಿ ನೋವಿತ್ತು ಕಾಲು. ಈಗ 1 ವರ್ಷದಿಂದ ತುಂಬ ಜಾಸ್ತಿಯಾಗಿ ಓಡಾಡೋಕ್ಕಾಗ್ದಂಗಾಗಿ ನಮ್ಮ ಮಗ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಕರ್ಕೊಂಬಂದರು. ಬರುವಾಗ ತುಂಬ ಭಯ ಇತ್ತು ನನಗೆ. ಒಳಗಡೆ ಬಂದಮೇಲೆ ಡಾಕ್ಟ್ರುಗಳು ಎಲ್ಲ ಭಾಳ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಂಡು ಇದು ಮಾಡಿದ ಮೇಲೆ ಸಂತೋಷವಾಗಿ ಎಲ್ಲ ಕೋಪ್ರೇಟ್ ಮಾಡಿ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಂಡ್ರು. ಭಾಳ ಸಂತೋಷವಾಗಿ ನಗ್ತಾ ನಗ್ತಾ ಹಾಸ್ಪಿಟ್ಲಿಂದ ಹೋದೆ. ನೋವೇನೂ ಇಲ್ಲ.
My name is Suresh. I am son of Saroja, who recently got operated here. She is aged 73 years. Last 4 years, she had a lot of knee pain and difficulty in walking and doing her daily activities. We had decided to go through a checkup and to take care of medications or whatever the doctor suggests. Dr. Ravi Verma, the neuro head, told about Dr. Thirumalesh here, and Aster being a big name, we heard so much. So we decided to come here and we met Dr. Thirumalesh Reddy, who went through a checkup and whatever the basic procedures has to be done, then he suggested for a surgery. When we decided and entered the hospital, we were so delighted to see such a wonderful facility. The staff, the doctors, the supporting staff, everybody is courteous and a wonderful facility to get operated my mother here. And from the point of entry to the discharge, we were very well taken care. The staff were very good and they never let us down. We are very, very happy and delighted about the services, the way they handled everything. We are very happy. My mother is also very happy. I can see a smile on her face. I thank once again Dr. Thirumalesh Reddy, Dr. M.S.Somanna and the team and the support staff, nursing staff. They were very, very careful, caring, good and courteous.
Yeah, hi, I'm Dr. Thirumalesh. I'm the Senior Consultant in Orthopedics and Joint Replacement Surgery at Aster CMI Hospital, and I would like to give a brief introduction about our joint replacement program at this hospital. We are a team of doctors here at Aster CMI Hospital. I have a senior colleague, Dr. Somanna, who is also trained in sports medicine and joint replacement and arthroscopic surgeries. So we normally sort of, after the initial screening in the outpatients, we have a counseling session for all the patients who potentially need joint replacement surgeries, wherein they would be given a virtual sort of tour of what sort of lies ahead of them if they do decide to undergo the surgery. So this would involve the minor details regarding the preoperative investigations and the few technical details regarding the actual surgery itself, and mostly in detail with the post-operative recovery and rehabilitation events that will happen while they are in hospital and also once they go home. I would like to say a few words about one of our patients who sort of we operated recently in the last month. This lady came to us with severe pain in both her knee joints, with difficulty to walk even a few yards, and although she was aware and she was told that she would need although she was aware and that she was told she has severe arthritis in both her knees, and she was told to undergo knee replacement to both her sides. She was very reluctant, mainly because she was sort of anxious and apprehensive with the experience of her other family members who had had similar procedures done, particularly with regards to pain after the surgery. So this lady was referred to our unit by one of our colleague doctors in this hospital, and somehow the lady got convinced to have her surgeries done here, and she underwent both the knees, she underwent both knee replacements on the same day, and both the sides on the same day. Her just as a any other patient who undergoes a knee replacement, there were few challenges with this lady, especially so because she had deferred the surgery for a very long time, and as a result of which she had developed a little more than usual deformities and the difficulties technically from a surgical point of view. So those were anyway addressed, but particularly from her concerns regarding her pain management, we have a very good pain management team run by our anesthetic doctors, and as a routine we put all patients post-surgery on epidural infusions or nerve blocks, which keeps them completely pain-free for the first few days until the pain naturally tends to settle down, at which point these would be withdrawn and routine medications like tablets would be introduced at that point. Then as a usual practice, we mobilize the patients on the very first post-operative day, provided they have sort of completely, we mobilize on the very first post-operative day with the help of a walker, and this would slowly progress to them walking without any individual support and just with the support of the walker. And we have a very good support from our physiotherapy colleagues who would work with the patients right through the day and evening and help them to learn their exercises and allay their fears regarding the recovery post-surgery. And by the time the patient gets discharged from hospital, which would usually be about 5 or 6 days following surgery, they would be independently walking with the help of walker and would be on usually 1 or 2 painkiller tablets, which they do take when the pain is really disturbing them. So overall, I would like to sort of say that the joint replacement is one of the most commonly performed surgeries all across the orthopedic units in the world, and the specialty and the important aspects would be to sort of choose the right patient and mostly to address the individual concerns that the person would come with, not just the technicalities of one having an arthritis and performing a knee replacement surgery. So in this particular patient, she was quite happy with the with the pain management during the hospital stay and also post discharge from hospital, and when she came back, and that is something that I would like to emphasize about our unit.